Welcome back to Patch. I'm Chris,
I'm Sawyer.
and today we're going to be talking about the effects of prenatal tobacco. Uh, with tobacco is the most commonly used substance during pregnancy. Up to 25% of pregnant women smoke. Nicotine crosses the placenta and is concentrated in the fetal tissue. The direct effect of nicotine hits the child a lot harder, as well as pre- nicotine predict deficits in growth and neural development, which in the long term have major effects on the brain function, the cognitive, and the behavior. Indirectly, nicotine affects the size through pathology. Recent studies have improved on earlier methodologies with prospective designs, biological measures, and statistics control of confounders. Current research has also uses more sophisticated measurements, including objective neurobehavioral batteries, neuroimaging techniques, and measurements of genotypic vulnerability.
Neonatal and infant outcomes. Most recent research on infants has focused on behavior. Using the Brailsden Neonatal Behavior Assessment Scale, one study compared 25 infants of women who smoked at least 5 cigarettes per day. Infants of non-smokers' urine cotinine levels significantly correlated with infant irritability, attention, and decreased response to inanimate auditory stimuli. Paternal smoking in the absence of maternal use was also significantly correlated with infant cotinine level and irritability. Another study examined 962 mother-infant pairs from the Providence cohort of the National Collaborative Prenatal Project. Using the Graham-Rosenberg behavioral examination of the neonate prenatal tobacco exposure was associated with increased irritability and hypertenacity, controlling for maternal socioeconomic status, age, race, and infant birth weight. This study represented the large investigation of the effects of maternal smoking on examiner-assessed neonatal behavior. Infant temperament at 9 months was studied in a cohort of over 18,000 infants. Infants of heavy smokers scored at least well on the Carey Infant Temperament Scale, whereas women who quit smoking had infants with higher scores on the Easy Temperament Scale. These findings remain robust after controlling for socio-demographic factors that correlated with maternal pregnancy smoking status.
Childhood outcomes. Studies of the PTE effects in childhood dealt primarily with behaviors such as the outcome. In a study of 2-year-old children in New Zealand, PTE was assessed retrospectively at the 6 weeks postpartum visit. The child's behavior checklist was completed by the mother when their children were 24 months old. Tobacco experienced children had higher rates of internalizing, externalizing, and total problem scores after controlling the prenatal alcohol exposure. Sociodemographic factors, maternal health, and parental practices. A study of maternal smoking during pregnancy and maternal exposure to environment tobacco smoking during pregnancy found that 7 to 15-year-old offspring mothers with only secondhand exposure during pregnancy also had more conduct disorder symptoms after effects of income, parental antisocial tendencies, prematurity, birth weight, and parenting practices were controlled. This was the study to demonstrate the effect of ETS on the externalized behavior and exposing offspring. Over 52,000 children from birth to age 7 years, only low birth weight, and higher odds for being overweight at age 7 were associated with PTE. Intelligence academic achievements conducting problems in asthma were not associated with PTE. The authors argued that the effects of smoking during pregnancy may not be distinguishable from a broader range of family factors associated with maternal smoking.
In contrast to the study above, Rosa found no increased risk of behavioral problems in the Dutch sample of 18 months olds who were prenatally exposed to maternal and paternal smoking after controlling for the effects of SE and parental psychopathology. In a longitudinal study, offspring between the ages of 4 to 10, offspring with PTE were compared to siblings no PTE, or that's all.
Have a wonderful day.